Hey, this week I will discuss the process of searching for exercise science articles and critically evaluating the evidence. Understanding how to locate and assess research is an essential skill for exercise science professionals because evidence based practice relies on integrating the best available research with professional expertise and client needs. When searching for exercise science articles, I use several academic databases to find reliable and peer-reviewed research. The database I find most valuable is the Sports Discussion because it focuses specifically on exercise science, sports performance, physical activity, and related topics. I also use the PubMed for exercise physiology and health-related research, as well as Google Scholar as a supplementary tool to locate additional studies and citations. My search process begins with identifying key concepts from my research question. For example, if I am studying muscular strength development, I might use keywords such as resistance training, muscular strength, young adults, and exercise intervention. I often combine the terms using Boolean operators such as AND, OR, and NOT to narrow or expand results. Filters are also extremely helpful as I typically limit the results to peer-reviewed articles, full text availability, human participants, and publication dates from the last 5 to 10 years. These strategies help reduce irrelevant results and improve the quality of evidence I locate. According to Eminet, English, and Kramer, evidence-based practice requires practitioners to systematically search for and evaluate scientific evidence before making professional decisions. Effective search engines help ensure that recommendations are based on current and credible research rather than personal opinion or anecdotal information. Similarly, Bishop and colleagues from 2021 emphasized that exercise science professionals should continuously integrate current research findings into practice to improve performance outcomes and client care. After locating articles, I evaluate their credibility and relevance using several criteria. First, I examine whether the article is published in a reputable peer-reviewed journal. The peer review increases confidence the research has been evaluated by experts before publication. Second, I assess the study design. I see the randomized controlled trials and the systematic reviews are generally considered stronger forms of evidence compared to observational studies because they provide greater control over variables and reduce potential bias. Hennigan and Badenoch from 2017 explained that higher levels of evidence, such as systematic reviews and meta-analyses, often provide the most reliable information for evidence-based decision-making. Likewise, Garchick and colleagues demonstrated the value of systematic reviews by combining findings from multiple studies to evaluate the effects of resistance training frequency on muscular strength. Third, I examine the sample size and participant characteristics. A study involving trained athletes may not apply to beginners or older adults. Therefore, I consider whether the participants resemble the population I am interested in studying or working with professionally. I also evaluate the methodologies, statistical analyses, and conclusions as I look for clear procedures, appropriate measurements, and results which are supported by the data. Additionally, I pay attention to limitations discussed by the authors because acknowledging limitations demonstrates transparency and helps the readers understand how findings should be interpreted. Now, one challenge I frequently encounter is finding articles both recent and directly related to my specific topic. Sometimes a keyword search returns hundreds of results, many of which are only partially relevant. To address this challenge, I refine my search terms, apply additional filters, and review article abstracts before reading the full studies. Another challenge I see involves interpreting statistical information in determining whether findings are practically meaningful. A result may be statistically significant, yet have little practical value for athletes or fitness clients. Reading systematic reviews and meta-analyses has helped me better understand the overall strength of evidence and identify consistent findings across multiple studies. McMaster and colleagues from 2018 note how understanding research methodology and data interpretation is essential for accurately applying findings within exercise science settings. Through this process, I have learned how not all published research carries the same weight. Evaluating study quality, participant characteristics, methodology, and applicability are only as important as finding the article itself. These skills help exercise science professionals make informed decisions and provide evidence-based recommendations, improving client outcomes. Now, searching for exercise science literature requires effective use of databases, keywords, and filters, while evaluating evidence requires careful examination of study quality and relevance. Although challenges exist, developing these skills strengthens our ability to apply research findings responsibly and supports evidence-based practice in exercise science. As future exercise science professionals, our ability to identify credible and impactful evidence will help us make better decisions for athletes, clients, patients, and the communities we serve.